And joining me now is Dr. Randeep Guleria, Director, All India Institute of Medical Sciences, also part of the COVID task force. Appreciate your joining us as always, Dr. Guleria. It's a pleasure having you. We are going to take a lot of viewer questions that have come in. The big question, sir, at the very outset, what explains the surge specifically in one state like Maharashtra? 58% of the cases coming from one state. Is there a strain which is different in Maharashtra, which is more infectious?
I don't think so. What I think is, as we know how the pandemic behaves and as we've seen it in the past, it starts in one region and then spreads to the other. It happened in Italy, it happened in Spain, it happened in the US, where it started off in New York and then spread to the other parts of the United States. So pandemics move from one area to the other. Currently, Maharashtra is seeing a huge number of cases because that's where if it's a new variant strain or the infection has spread more rapidly. But it is now gradually moving to other states, and that is a cause of concern because for the first time we have crossed the 1 lakh mark per day, and we have done this in a very steep manner, and this is a grave cause of concern.
So you're saying that in the days ahead it may not be limited to Maharashtra, the numbers could rise exponentially in other parts. Am I correct, doctor?
Yes, unless we are very aggressive in the actions that we take, this could sort of spill over to other states, and that could cause an increase in the overall numbers in the country.
I'm going to come to that action in a moment, Dr. Guleria, because my next question is quite simply what Maharashtra has done, doctor. Do night curfews and weekend lockdowns work? Maharashtra has gone in for night curfews and now for a weekend lockdown. Is that a solution in your view to break the chain?
That's not a total solution, because if you have a night curfew, but during the day you allow people to mix, you have crowds and you have people not wearing masks, then you're still allowing the infection to spread. So even if you limit it, that there is a curfew in the night, but there is no restriction in the day, it's not going to be really effective. And that is why we need to have more aggressive action in terms of making sure people follow COVID appropriate behavior, making sure that the crowds are not formed so that they don't become super spreading events, and therefore activities which can lead to crowd formation are totally not allowed. And we start doing a very aggressive surveillance to pick up those areas which are hotspots and sort of convert them into containment zones and have some sort of a lockdown strategy in that area so that the infection doesn't spread from that area to other areas.
You know, doctor, you made two important points already. One, you're saying this surge may not necessarily be limited to Maharashtra, it could spread to other states. And you're saying also that a night curfew and a lockdown only for a few hours or a weekend doesn't work. Therefore, our next question is, how real, doctor, are fears of another national lockdown? The Prime Minister has called a meeting now of Chief Ministers on the 8th. You're part of the COVID task force. Is it possible that what's happening in Maharashtra could be replicated in other parts? Could we be heading for another national lockdown?
I don't think we'll have a national lockdown, but there could be regional areas which would take such measures in terms of having containment zones, looking at lockdown in that area. And also very aggressive testing, tracking, treating and isolation needs to be done, because we have to really decrease the number of cases or at least not allow the cases to rise with the rapidity which they are rising right now. And the reason for that is that if we allow this to happen, it will lead to more strain on the healthcare facilities. The more the number of cases you have, proportionally larger the number of people who would need hospital care, and more will your healthcare facility get strained in a shorter span of time. Mm-hmm. If the healthcare facility is already overburdened, this may create a problem as far as management is concerned. Therefore, the only option that we have is to work aggressively to decrease the number of cases so that the number that really needs hospital care doesn't rise up and exceeds what we have currently available.
Okay, so you're saying no total lockdown. If there is a lockdown, it will be much more localized. It should be directed at areas where surges are detected. You also mentioned, doctor, earlier that we need to avoid crowded places or overcrowding in places, which brings me to another question. Can the Kumbh Mela, IPL, lead to a rise in cases? The IPL begins on the weekend, ironically, in Mumbai. The players are in a bio bubble. There are no crowds. But the Kumbh Mela is on in Haridwar at the moment, and linked to that is elections. So, two questions, doctor. Is a surge likely in election states? And can the Kumbh Mela, IPL, lead to a rise in cases?
So any event where there is a large crowd and there is no COVID appropriate behavior can become a super spreading event, and therefore one should try and avoid as much as possible such events. or be very strict in the type of restrictions that you put in there to prevent people coming there who are COVID positive and are likely to spread the infection.
No, so why, sorry doctor, why hasn't the COVID task force sort of read out, dare I say, a red card to our politicians saying, look, you're holding these big rallies where people are coming without masking, without social distancing, maybe we need to find some way to control that.
Yes, and I think it's also individual's responsibility. After all, people who are coming to these rallies also should understand their own responsibility, wear masks and make sure that they don't form a crowd. It's something that has to be done both. So if people started doing this and not coming to large rallies or not coming to where there's a big crowd, automatically we would be able to bring it down. But if you are not having that and you don't understand your responsibility, then it's going to be a difficult situation. So it's something that has to be done from both each individual and also from as a group in terms of decreasing the crowds and making sure that there is COVID appropriate behavior.